Ebola. Ebola is a hemorrhagic fever and it's a big problem in today's society. You see it everywhere you go. You see it on the internet, in your news feed, on social media, on the homepage of search engines, and you also see it every time you look at the news. It first started in the Democratic Republic of Congo. They detected symptoms after a person has become affected. The virus has spread worldwide, and a few people have survived. Ebola, the first case of Ebola was in 1976. Named after the Ebola River in the Democratic Republic of Congo. It was first discovered in Zaire in Africa. There are 5 strains of Ebola, 4 affect humans, and the last affects a few animals called the restin virus. The virus is limited to Africa, and a few places that has been discovered is in Democratic Republic, the Republic of Congo, Uganda, Liberia, South Sudan, Sierra Leone, Guinea, Gabon, and the Ivory Coast. Other areas that affect are South Africa because of the importation of the virus, and it's also found in England and Russia due to a laboratory accident case. It has spread very quickly. The CDC experts think that it's caused by the spread of the virus through bodily fluids. The first person to catch Ebola is still unknown, but the people that care for the person with Ebola in the hospitals and people that care for them at home are at the most risk. Since October 20th, there have been recorded the cases of Ebola. In Senegal, there's been 1 case and no deaths. In Guinea, there's been 15,039 cases with 952 deaths, and those are some of them. In the United States, there's been 3 cases and 1 death. In Senegal, the virus came from Guinea, and in the United States, the virus came from Liberia. Anyone that comes in contact with a person who catches Ebola after they develop symptoms is at liability of catching the disease. There are a few ways to catch the virus: through broken skin or through the eyes, nose, or mouth. Most common symptoms are headaches, diarrhea, vomiting, and mostly stomach pain. Others experience rashes, red eyes, difficulty breathing, and swallowing. In the bloodstream, the virus can cause internal bleeding, causing the person to bleed out. Everyone who is affected differs. The mortality rate is between 50 and 90%, and the virus can also cause malaria and cholera, which causes detection of Ebola to be delayed. Prevention and treatments. There's no FDA-approved treatment. The basic interventions are IV drips, body salts, maintain oxygen and blood pressure, and they have experimental vaccines and treatments under development, but they're not safe for humans or not approved by the FDA. The recovery also differs. It depends on the care and immune system of the patient, and if they do survive, they develop antibodies that can last longer than 10 years, even longer. But it doesn't mean that they're immune to the virus forever, or that they can't catch one of the other 4 strains of the Ebola. After recovery, some patients get joint or vision problems, and they have cut down on airport travel. There are 5 airports open: the Kennedy International in New York, Washington D.C. International, the O'Hare International in Chicago, Hartsfield Jackson International Atlanta, and Newark Liberty International in New Jersey. The prevention methods in the airport: they have no-touch thermometers. They also check the people that travel in Liberia, Sierra Leone, and Guinea. And if they suspect someone has Ebola, they take them to an isolation tent and then they question them. But even though they have all these efforts, it still won't stop the virus completely. To stop the spread of Ebola, you should practice careful hygiene, avoid contact with body fluids, don't touch items that an infected person has touched because their body fluids could be on it, and avoid funeral burial rituals that involve touching the dead bodies of people who have Ebola. Avoid hospitals in West Africa where they're treating patients with the Ebola virus, and monitor if you have come in contact with the virus. You should monitor your health for 21 days. Because it takes a 2 to 21 day incubation period for the virus to develop. Healthcare professionals should wear personal protective equipment, practice proper infection control, sterilization measures, isolate patients with Ebola, and avoid direct contact with dead patients, as well as notify health officials if they think they have come in contact with the virus. Some Ebola survivors are the nurse named Nina Pham. She was part of the 70 staff at Texas Health Presbyterian Hospital. She treated Thomas Eric Duncan, who died from Ebola. She was the first American to contact the virus in the U.S. They can't find any way that she reached safety precautions with the virus. She received a plasma donation from Kent Brantley. He's the first American to return to the U.S. from Liberia with the virus. He donated blood for 3 transfusions to other people, including Nina and Duncan. But Duncan's blood type didn't match his, so he died from Ebola, and she survived. The Ebola virus is a huge problem because of detection, because of how long it takes for the virus to develop. The prevention methods show progress, but they won't completely stop the virus because of people still being able to come in through airports from Africa. And survivors like Kent Brantley still are trying to help others beat the Ebola virus.